we're exploring careers in the healthcare industry. And while you may think of that as just doctors and nurses, there's a whole host of other jobs that need your skills and abilities. So let's go explore them together. Today we're at Columbus Community Hospital, and I'm here with Melinda Allen, who's an employment and education coordinator. Melinda, just give us a little overview of what happens at Columbus Community Hospital.
Absolutely. Well, Columbus Community Hospital is an acute care hospital. But what does that really mean?
Sure.
We have an ER, an OB department, but we also have a lot of specialty areas like a cardiac cath lab. We have a senior behavioral health unit, and then a lot of different clinics like a psychiatry clinic, a cancer care clinic, and we're building a new field house right now, which will house our sports rehab and performance training.
Okay, so tell me a little bit about your role as an employment and education coordinator. What do you do, and how did you get to this role?
Absolutely. So I recruit, onboard, and train new staff. And I didn't get here traditionally. I started out in education, going to be a teacher. And then I really wanted to branch out and work to help people. So I ended up working for the government, and then I found a special love for healthcare.
Okay, is there a young professional who works here that we could probably talk to and learn about their role and how they got into it?
Absolutely.
Okay.
I have someone in mind. Her name is Heather, and she is a respiratory therapist, and she started out through an apprenticeship program. So I'd love for you to talk to her.
Okay, sounds like she's got a great story. Let's go talk to her. I'm here with Heather Hirota, who's a certified respiratory therapist. Heather, tell us a little bit about what a certified respiratory therapist does.
A certified respiratory therapist, or CRT, is someone who is going to work in the hospital and kind of deal with lung processes. So, and you can work throughout the whole hospital. You can be in the ER, having somebody on the vent. You can be upstairs on the floor and giving somebody a breathing treatment. You can be in a C-section and help a baby at birth.
Okay, so when you talk about a vent, help us understand what that is and what's involved with it.
Sure, so a mechanical ventilator is when someone has a tube down their throat, and that tube is attached to a machine, and that machine is giving them every single breath that they need.
Okay, so the machine is essentially becoming their lungs for them.
Exactly.
Okay. Tell me about how you got into this job. What was it that landed you here?
Sure, so I started out as a graphic artist. I went to school for graphic design.
All right.
So I did that, and then I had a baby who was premature. And so he was born early, was in the hospital, and I learned at that moment that I really wanted to work in healthcare. So I quit my full-time job and I started here at the hospital. I started in the SPD department, which is the supply and purchasing department. They kind of do the storage rooms in each area. When I was doing that, I noticed that the respiratory people, they were all over the hospital, and I really liked that idea.
Okay. Yeah. So it sounds like your story was born out of seeing people caring for your son and then seeing their passion in what they did.
Definitely.
What was your education path to doing this job?
Sure, so the hospital offers a program. You apply for a scholarship, and they kind of help you through the process. And they helped me get my associate's degree. So they paid for every penny of it.
Wow.
I worked part-time here, learning on the job, and then also learning at school. And then the people here were also able to help me with homework if I had questions. So I appreciated that as well.
Okay. So what degree did you end up with when you finished your training?
So I have an associate's degree. I did take boards, and that allowed me to get my CRT. And I will take another board, and then I will get my RRT, Registered Respiratory Therapist.
Now, what are some of the rewards and challenges in your role?
Sure, so one thing that's really awesome is that someone might come into the ER and you might put them on a vent, and then you're gonna move them upstairs to the ACU, okay? And then they're gonna be on that vent, and you're gonna have to wean them off the vent. And so you kind of watch them get better and get to go home.
Okay, how would someone know if they wanted to do this type of job? Is there a characteristic or something that they love that really fits well for a respiratory therapist?
Sure, I think really anyone can do respiratory, but you definitely want to be able to be a good instructor. That's something that you should be able to do because you do have to instruct quite a bit in this field.
So maybe you could show us one thing of what it's like to be a respiratory therapist. Is there something you could show us?
Sure, I'll show you the PFT machine.
Okay. All right, Heather, what is this machine that I'm getting into?
This is the PFT machine. This is going to measure your lungs. So any disease process that's going on, we're going to detect that today.
Okay, and I've got these fancy nose plugs. Do I need to wear them?
Yeah, go ahead and put those on.
Okay, all right.
And at first I'm going to have you just breathe in and out, in and out. And then we're going to do a big deep breath in. You'll breathe in for quite a while and then we'll blow out.
Okay, sounds good.
Okay? Okay, just normal breathing. In and out, in and out, in and out. You're doing good. Okay, deep breath in, deep breath in, deep breath in, deep breath in, deep breath in. Blow out, 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 blow out. All right, good job. All done.
And so this is measuring my lung functionality, right?
Yes.
Okay. And did I do okay?
You did excellent, yes.
All right, I got a green check mark.
You got it. You did a good job.
Thank you.
You're welcome.
Well, thank you, Heather, for showing us your career path and a little bit of what your job is like, even though I had to wear these nose plugs during that time.
You're welcome.
Well, if working with patients directly and getting to experience all different areas of a hospital sounds interesting to you, then becoming a respiratory therapist might just be the job for you.